Clostridium difficile, also known as C. diff, is a bacterium that causes an inflammation of the colon. It is the most commonly recognized diarrheogenic pathogen among hospitalized persons. C. diff can also cause outpatient diarrhea. C. diff causes diarrhea linked to 14,000 American deaths each year. Knowledge of C. diff was dependent upon 3 lines of studies: the initial work, which took place in 1935, the rodent model, and the studies of pseudomembranous colitis. Pseudomembranous colitis became a commonly recognized complication of antibiotic use in the 1950s. In 1974, the C. diff era began. Early detection of C. diff involved hamster models and clinical specimens performed at a hospital in Birmingham, England, where C. diff was an endemic on a surgical division. In most of the early studies, the hamster model turned out to be a pivotal method in establishing detection of C. diff.
C. diff is a type of bacteria that can be found in the environment, especially in soil, air, water, human and animal feces, and food products like processed meats. This particular bacterium can also be found in the large intestine of some humans. However, in this case, C. diff is usually harmless, therefore these particular people rarely contract an illness from the infection. C. diff infections have various causes. It often occurs in hospital and other healthcare settings where there is a greater percentage of people carrying the bacteria. It is spread through fecal interaction with food, surfaces, and objects, as well as improper hand hygiene. Because this bacterium produces spores, it can live on surfaces for weeks to months, therefore increasing its ability to infect and harm humans. Humans often touch these contaminated surfaces and swallow the bacteria unknowingly, which leads to a serious infection. Even though the intestines produce normal and healthy bacteria that protect humans from infection, antibiotics that are used to treat harmful pathogens often kill the normal flora, giving C. diff the ability to grow rapidly and become toxic. Once C. diff establishes itself in the intestines, it begins to release toxins that attack the intestinal lining and create patches of inflammatory cells while killing the normal flora. This cellular debris in the colon is the cause of the watery diarrhea.
A key symptom of mild to moderate C. diff is diarrhea 3 or more times daily for at least 2 days. Another symptom of mild C. diff infection is mild cramping or tenderness in your belly. More severe symptoms of C. diff include watery diarrhea many times throughout the day and night, and very bad cramping in your belly. Other symptoms of severe C. diff are fever, blood or pus in the stool, nausea, and dehydration. Loss of appetite and weight loss are also common symptoms of a more severe case of C. diff.
Preventative measures for C. diff include hand washing. Healthcare workers should practice good hand hygiene before and after treating each person in their care. In the event of a C. diff outbreak, using soap and warm water is a better choice for hand hygiene because alcohol-based hand sanitizers do not effectively destroy C. diff spores. Contact precautions. People who are hospitalized with C. diff have a private room or share a room with someone who also has the same illness. Hospital staff and visitors wear disposable gloves and gowns while in the room. Thorough cleaning. In any setting, all surfaces should be carefully disinfected with a product that contains chlorine bleach. C. diff spores can survive routine cleaning products that don't contain bleach. Avoid unnecessary use of antibiotics. Antibiotics are sometimes prescribed for viral illnesses that aren't helped by these drugs. If you need an antibiotic, ask your doctor to prescribe one that has a narrow range and that you take for the shortest time possible. Risks for C. diff include taking an antibiotic during the past 30 days. Antibiotics can kill the good germs or normal flora in your intestines. You have an immune system that is weak from a major chronic ongoing illness. You are a woman 65 or older, or you take a medicine for heartburn or to lower the acid in your stomach. These medicines include Prevacid, Prilosec, or Nexium.
C. diff can be treated in a few different ways. The first and most common way is through a 10-day course of oral antibiotics. Metronidazole is usually tried first, but if that is not effective, then Difficid or vancomycin would be prescribed. Patients can expect to see their symptoms improving around 72 hours of starting their antibiotics. Sometimes antibiotics may not be effective and the patient's diarrhea may temporarily return. In 25% of cases, a second round of antibiotics may be needed to be fully cured. A newer way to treat C. diff is through fecal microbiota treatment. Although FMT is not yet approved by the FDA, it has proven to be a very effective treatment. FMT works by placing another person's stool in your colon. This can be done directly into the colon using a colonoscope or through the GI tract into a nasogastric tube. FMT helps to restore healthy intestinal bacteria that a patient needs to help cure C. diff. Before this treatment can take place, donor stools must be screened carefully and repeatedly for parasites, viruses, bacteria, and certain antibodies. If a patient presents with watery stools or diarrhea, they will be tested for C. diff. Some examples of diagnostic tests are colonoscopies, X-rays, or CT scans of the colon. Also, stool can be tested to see if it contains toxins produced by C. diff.